Mama Maziba Maternity Referral Health Center is a public health facility serving some of Kinshasa's poorest residents. Nearly 80 babies a month are born in the maternity center here. But when mothers cannot pay their bills, they are not allowed to leave. 21-year-old Beloni Ngoi gave birth to her first child, Erika, during the coronavirus confinement.
They told us it would be a boy, so we did put aside the $35 needed. Then they told us they would do a C-section, so there were additional fees.
Beloni's husband installs cable television, but the confinement has left him without work, and the family is struggling to gather the $250 needed for the hospital bill. Until they pay, Beloni and baby Erika are not going home. Micheline Ileko, too, is stuck at the hospital.
When I arrived to give birth, I had nothing. They eventually agreed to take care of me, but I had to discuss it a lot. I really had to beg.
Micheline gave birth to her third child, Marveline, and now cannot pay the $50 bill. She says she understands why she and other mothers are not allowed to leave.
They check up on us. That is the way of the world. Money fixes everything.
Dr. Eric Massina is director of the health center.
Go back home? How, my dear? There are people who have done the work. Some drugs that have been used, medicines we have used, many things we have used. And who is going to pay for that if we let them go?
C'est une situation qu'on a toujours déplorée.
This is a blatant human rights violation. Detaining an individual for default of payment, especially a woman, is violating the law.
C'est violer les droits.
Attorney Elodie Ntimire Muzigirwa is a patients' rights advocate who says Congolese authorities must do more to help new mothers.
Le ministre est passé dans
The Minister of Health visited a few facilities and made sure that some detained women were discharged. But that only happened while he was present. That is not the goal. That is not the ideal way of dealing with such an issue. He said those measures would be effective in all health facilities, in both Kinshasa and in the provinces. It never happened.
Dr. Massina says he's sympathetic to the economic situation, but for women who cannot afford to give birth, it is an issue of family planning.
There is no way one can stop these ladies from giving birth. Simply impossible. They need guidance. However, we advise and encourage them to use birth control. For the poorest, we provide the birth control. It is not mandatory. It is their life after all. We simply try to help them choose to rest, say, 5 years and improve their socioeconomic status so they can come back and deliver without these problems.
Attorney Elodie Muzigirwa says Congo's health ministry recognizes the problem and the work she's doing with the United Nations to boost patients' rights. It is not about changing some laws, but more about rebuilding Congolese healthcare, she says, as new mothers stuck in hospitals are symptoms of a sick system. Anasthasie Tudieshe for VOA News, Kinshasa.